just like any kid who plays a sport, a cricket or a football professionally, the dancer also should work through the same way. So work on your flexibility and your skill and start early. Right? So your bone gets adapted the way you want to. Starting late is a disadvantage because in the soft tissue, and the muscle, ligaments, adjust agum. So the bone on the fuse side, once you hit your growth spurt. So then you don't have much of a chance. That is one. And second is when children are going for Arangetram, so they have to space it out. They cannot do, most of them, or 3 days before the Arangetram, they come and say, my knee is swollen, my ankle is swollen, can you do something? Right? So they have to space it out. You have to plan when you're going to do your Arangetram and how you train and how you space it out so that there is no rush towards the end, pushing the children in the last minute. So spacing it out and giving them enough recovery. So sleep, having enough water, not training hard every day. One day you focus only on abhinayas, one day you do focus on footwork, one day you focus on jumps. So you split it so that they don't do the same activity every day. So the chance of injury is less. Right? Because an injury can be a big deterrent for the kid to get back to what they really like to do because they get scared and it is not enjoyable. When you're dancing with pain, you don't enjoy it, right? So you're not giving your 100%. So preventing an injury is the first thing. So start early. And second is once you come to the age of 15, right? So we have 4 types of fitness. One is your cardiorespiratory fitness, which is your heart and your lungs. Second is your flexibility. Third is your muscle strength and endurance. And fourth is your body composition, the fat, how much fat you have in the body. So all 4 parameters have to be taken care of, right? You have to dance is an athlete. Right? So they have the same demands. You have to have good cardiorespiratory endurance. If you have to do a piece for 20 minutes, 30 minutes, a very dynamic piece, you should have the stamina to do it. You cannot be panting when you do the performance. And you should have enough strength to do the jumps or to get into one position and hold that position. And you should have the flexibility. And like sir was telling, 1 kg extra is 4 times the load on the knee. Right? So 1 kg of active weight is acceptable. Active weight is like a muscle weight is acceptable. 1 kg of a redundant weight or the useless weight is a fat weight. So that is an extra load on the joint because the fat will contribute to performance. It is a stored energy, that's all. So your body composition also plays a role. These are the 4 parameters you have to look at once you hit 15. Right? And fitness is for lifelong. It's not something you do now and you leave it and thinking that if I go to the gym, I will lose weight, but if I stop the gym, I will put on weight. So that's a myth actually. So any activity you do, if you go for a walk every day and you stop walking for 3 months, you will put on the weight that you lost, right? So you have to think your fitness is for your lifetime or your activity that you're doing is for your lifetime. Second myth is, if the girl goes to the gym, she'll become like a man. She'll put on muscles like a man, right? So women do not have the hormones to bulk up. You need testosterone for the muscles to become big like men. Right? So they don't have that hormone, so they will not bulk up. They'll get only stronger and better toned and better shaped when they go to a gym or they work on the exercise. So again, everything has to be moderate. You cannot go bang bang and do heavy stuff in the gym. So you have to have in moderation. A lot of young dancers of this generation have understood that and they're already in that path. Right? They know what is really needed. Right? And recovery. Recovery is having enough sleep, having enough water, having nutritious food. And the days you're training, make sure you have enough protein in your diet. So all these play a role to prevent an injury. Right? So if you keep these basic things in mind and you work towards it, I think one is the basic one everybody is looking at is preventing an injury. You don't want somebody to get injured. Right? And then getting back, we say we get them to near normal. Rehab is about getting them to near normal, not 100% back to what your original tissue was, right? But so why get into that? So first is prevention, and then make sure you space out your routine. If you go on a tour, you have only on weekends, Saturday, Sunday you do, and the rest of the 5 days you have time to recover and do other things to work on, right? Instead of practicing every day, doing the same movement every day will only cause an overuse injury, right? So the 2 types of injury you have to look at. One is acute injury, like she had. You jump, twist your knee, and you have an injury. Second is a repetitive injury. Doing the same activity over a period of time will lead to wear and tear, like a tennis elbow. right? For people who work in the computers. Like that. For dancers, we have something called as a dancer's knee, which is a little different.